let's change course a little bit and talk about MRIs. So there's an MRI on almost every corner, and the fact that MRIs are so readily available has led to this new category of individuals, the radiologic isolated syndrome, because there's so many done that they picked up these changes in an asymptomatic population. What are the impacts of MRIs in terms of managed care and at a population level?
Well, you definitely bring up a good point. I mean, for a while we struggled with clinically isolated syndrome, then various agents got approved for clinically isolated syndrome, so it didn't create a struggle. I don't think we have anybody approved for a radiologically isolated syndrome. However, what you say makes total sense. If a proportion, and I was struck by, was it a third of these patients will go on
34%.
to, so that's high.
Over 5
but
years.
when you're looking at a population, 2/3 of them aren't. And I need a way to better divine, those 2/3 who hopefully we aren't going to treat with these multi-tens of $1,000 a year therapy if they don't need it, versus the 34%. So, the MRI is a blessing and a curse. It's a blessing because you're going to find a group of patients, 1/3 of whom are going to be sick if you don't treat them. It's a curse because the other 2/3 may not need treatment, and we just don't know.
And it's not for diseases like MS that we worry about the MRIs. It's for all the other MRIs that we're doing. Never did any discussion in the 22 years that I've been practicing where I am that did MRI and ever talk about it with terms of multiple sclerosis, because truly it's on other kinds of MRIs.
Yeah, suspected MS is a guaranteed MRI. Nobody even
Or to
questions
evaluate
it.
the patient,
So-
diagnose the patient, et cetera.
Despite that, it's one of our bigger irritations is pre-approval of MRI. It's actually more annoying than it is pre-approval for the disease-modifying therapies, because the companies have gotten involved to make it easier to get people onto therapies, but the radiologists don't do anything, even though they collect all the fees, to get the pre-approval. If a patient shows up without the approval, they send them back up to our office and we have an annoyed patient with us. But this is actually wastes an enormous amount of time with staff in terms of getting what should be intuitive. In fact, arguing about getting a cervical spine MRI on someone who clearly has symptoms related to the spinal cord.
We actually do, we have a whole radiology program, and depending on what it is, it's software physicians put in, so they put in what they're using it for, and again, it's easy to use, and it would approve any multiple sclerosis patient. I'm not sure exactly what health plans or who you deal with. However, what could be happening in your situation, I'm just supposing this, is that unfortunately, because of the numerous MRIs and all the increase in all the different kinds of high-tech radiology, that they look at all of it the same and manage it that way. So only because of what's happening, I think maybe in other areas, that unfortunately you have some rules there in management too.
Well, it's particularly difficult in MS because there may be times, and there's often times, when you need to get MRIs 2 months after a whole series of MRIs. Right? Someone has a flare-up, and they're on a therapy, and you need to know what's going on.
Absolutely.
Yeah.
We agree with that.
And we have a lot of trouble with that.
Yeah, I couldn't disagree. I think Leslie hit, a lot of plans do make it very easy to get MRIs on MS or suspected MS. But then this is like casting the broad net when you're fishing. You want to catch tuna, but occasionally a dolphin lands in there, and it's annoying, for everyone. And I understand.
Especially the dolphin.
Yeah, especially the dolphin, yes.